Good day, everyone. Today, we have a couple of experts in here today, and we'll be talking to you. They'll be talking to you about sleep and sleep disorders in older adults. My name is Yaman, and I'll be a moderator. And we have Becca as one of our experts, Devin, and Jackson. They'll be talking to us today mostly about common sleep disorders and general recommendations for what to do about sleep disorders and how to sleep better.
From a neurocognitive standpoint, we know that poor sleep is related to memory decline, especially working memory and episodic memory and memory about one's own recent life. Older individuals, as you know, are afflicted by memory problems, and poor sleep seems to augment that memory decrement. Secondly, motor abnormalities, so falls. Interestingly, many studies have shown that in older individuals, one of the strongest predictors of falls, which we worry about a great deal, is poor sleep and short sleep time, independently of hypnotic medications or sleep medications.
So, Mr. Devi, can you tell us a little bit about that video?
Yeah, so that video goes over real quickly about just some of the commonly seen sleep issues and why it's really important, and especially in older adults, to be able to tackle these issues. And that's why we're here today, is to address these things and hopefully help you guys better understand some of the issues around sleep and sleep disorders in adults.
Thank you. So we did a little poll amongst the audience about the issue, and we asked them two questions. One being what they thought was the most common sleep disorder in adults, and another being the percent of adults that they think were mostly affected by sleep disorders. Now, for the first question, the audience believed that it was pretty equal between sleep apnea and insomnia, which was the most common sleep disorder in adults. But majority of the audience believed that 20 to 40% of adults age 50 and above are affected by sleep disorders. What are the typical sleep changes we see in adults?
Yeah, there's a lot of things that we'll be able to go into in more detail later on in the presentation, but this was really important for us to help kind of understand where our audience is coming from, to help us, be able to address the topics that need to be addressed. And so we'll be able to go into those in just a little bit.
Thank you.
Have tested how much is required each night by assigning groups of people to 4, 6, and 8 hours of sleep over extended periods of time. After 14 days, those with 8 hours of sleep exhibited few attention lapses or cognitive issues. However, those with 6 or 4 hours of sleep showed a steady decline. In fact, after only 2 weeks, the 6-hour group showed a similar reaction time to a person with a blood alcohol concentration of 0.1%, which is considered legally drunk. The 4-hour sleepers suffered even more, occasionally falling asleep during their cognitive tests.
Mr. What can you share with us about this video we just watched?
Yeah, so that video tells us a lot about a study that was done that shows how the lack of sleep can be extremely detrimental to your health and can really affect your reaction times a lot. I mean, they compared the lack of sleep that you're getting to the same way they would see reaction times in those who had a blood alcohol level that was considered legally drunk. And so it's kind of it shows kind of how important sleep really is to us, that it can really affect you in such dramatic ways. And
have tested how much is required each.
And if we go on to this next slide, we can see that we can just take an overall look on how the world sleeps. We can see that the recommendation on this one is about 8 hours of sleep. And then we can also see that on weekdays, people are only getting about 6.8 hours of sleep a night. And then on the weekend, they get a little bit more at 7.8 hours. But relating that back to the video where they were saying that in their study, those who were getting 6 hours of sleep were, having such poor reaction times that they can, compare them to those who are drunk. It's kind of insane. It's kind of crazy to think about how really important it is and how much we kind of are lacking in those needs in our sleep on weekdays. We can also see on this graphic that it shows that 80% of adults want to improve the quality of their sleep. And so that's kind of some of the other things we're going to give some tips on how to help improve in those aspects.
Thank you so much. So how much sleep do we need?
Yeah, so studies recommend that healthy adults get at least 7 to 9 hours of sleep. That's kind of a good range that we like to see people in. And while a large percent of the population does not get this, there are a lot of benefits that make good sleep worth your time. These benefits include improved mental, physical, and emotional health, and they also can improve the stress that you're feeling in your life.
So what are a few typical sleep changes that we see in adults?
Yeah, so there's a lot of patterns. That's a great question. As you get older, it is common to see an increased difficulty in falling asleep. Waking up more often, you're starting the day earlier, and you're having less deep sleep typically. These can be a nuisance, but there are ways to help treat these things. And so we recommend if you're dealing with these issues that you get in and see your primary care physician. That's going to be a good way to help you address these needs.
And what are some of the most common sleep disorders that people should be watching for?
Yeah, so two of the ones that we have are insomnia and sleep apnea. Insomnia is the most common sleep problem in older adults. People with this condition often have trouble falling asleep and staying asleep. It can last days, months, and even years. And having trouble sleeping can mean that, again, you're just taking a long time to fall asleep and you're waking up more times in the night. Comparing this with sleep apnea, people with sleep apnea have short pauses in breathing while they're sleeping, and these pauses may happen many times during the night, and if not treated, they can lead to other problems. So it's really important to go in and get these dealt with.
What tips would you have for anyone dealing with any sleep disorders? Just a few, please.
Yeah, there's a lot of tips. Some of these include creating a consistent sleep schedule, not eating or drinking before you go to bed, and making sure your sleep environment is stress-free. We also recommend getting outside. That's really helpful for your sleep.
Thank you so much, Mr. David. Now, Mr. Jackson, how do sleep disorders, sleep apnea in particular, affect breathing during sleep?
So there are a couple different types of sleep apnea. You've got obstructive, central, and complex. Obstructive, basically what happens here, your throat muscles relax while you're asleep. And then with central, your brain doesn't send the proper signals to those muscles that control your breathing while you're sleeping. Either way, it's going to affect your sleep, and the complex is going to be a combination of both of those. Either way just means you don't get quality sleep. You're going to wake up periodically. You can't get into the REM cycle. Risk factors, the risk does increase as you age, as your weight increases, heart disorders, it can be genetic, smoking. So obviously there are various risk factors, but it will cause daytime fatigue, like Devin said. Reaction time can be compared to that of a drunk person. You can increase high blood pressure, develop heart problems, type 2 diabetes. There are lots of things that can happen from it, and various risk factors that can lead to it.
Thank you. And how can movement disorders during sleep affect our sleep quality and duration?
So there are two types. You've got restless leg syndrome, which happens while you're awake as well. It's basically this irresistible urge to move your limbs. And you have something called periodic limb movement disorder, and this is while you're asleep. So unconsciously, then you're going to be moving, which if you're using your muscles, exerting energy, obviously your sleep quality is going to go down, and you're not going to get as good a sleep. It'll be every 20 to 40 seconds. As we can see in this graphic, it's going to affect your spouse as well. They won't get as good of sleep. And 80% of those with restless leg syndrome have PLMD. So it's not a complete overlap. So it just means to be moving while you're awake for restless leg syndrome, or you'll be moving specifically when you're asleep for periodic limb movement disorder.
Thank you. And can you tell us the effect that Alzheimer's disease plays on our sleep?
Yeah, so it's a cognitive disease. It's mental. Alzheimer's and dementia, and they're going to affect sleeping, which is also cognitive, has to do with your brain. So when you change the sleep it's going to change your sleep patterns. It's going to affect up to 50% of those that have severe dementia or Alzheimer's. One of the most common things is called sundowning, which just means when the sun goes down, people get confused, agitated, anxious, depressed, aggressive. They wander around, again, affecting the quality of sleep and then the amount of sleep they can get.
And can you talk to us about medication, please?
So there are medications that treat sleep, and there are medications for other things that affect sleep. So things like heart medications, medications for cholesterol, Alzheimer's, pain meds, those are going to affect people's ability to get to sleep and to stay asleep. Well, you can treat sleep disorders with other drugs, something like melatonin, or things that will help you get to sleep and stay asleep.
Thank you so much. And then, Ms. Beckett, are there any disorders that can keep someone awake? How does this affect the elderly?
Yeah, for sure. So this is a great question. There is a disease that keeps someone awake, and it's called narcolepsy. It's a chronic sleep disorder that people, when they have this, their brain can't control their sleep cycle. So they don't know when to go to bed. They don't know when to wake up. So they'll feel awake when they wake up, but then they're just really sleepy throughout the day, or sometimes it can be opposite. So this can affect more than just their sleep schedule. It can affect many other aspects of their life, and that really limits their ability to actually live and do the daily activities like brushing their teeth or going on a walk, because they have no energy to do these things. So narcolepsy can be really hard for someone, especially in older adults, as they are already struggling to do these daily activities due to other risk factors. It can determine that it's harder for them as they can't stay awake.
Thank you. And what other disorders can make someone tired all the time, and how does this affect the elderly?
Yeah, so there is a disorder. It's just mainly they have an umbrella term, excessive sleepiness. It's very common in older adults. I'm sure we've all seen it, and it's associated with cognitive decline. So this comes with bodily pain and can lead to other issues because the body just feels sleepy all the time.
And what's the prevalence, or how common are sleep disorders in the elderly, and what's the best way to get a good quality sleep?
Yes, so this is huge in the elderly. I mean, this percentage, 40 to 70% of older adults complain about maintaining sleep or even just trying to go to sleep. So very, very common. And to get good quality sleep, a lot of the elderly, we recommend to use medication. You know, if you need to use medication or if you need to go see a specialist, you should definitely do those things that you can get the best sleep you can.
Thanks so much. Now we have a couple of questions from the audience in the chat box, and one of the questions is, what are the tips and treatments for dealing with sleep disorders and falling asleep, and any good sleep habits?
Yeah, so a couple of tips here are to stay physically and mentally healthy and maintain a good sleep schedule, like we talked about, with getting 7 to 9 hours of sleep every night.
And then what is the best way to ensure safe sleep for elders?
Yeah, the best way would be to develop good sleep habits while making sure that you're comfortable while sleeping and staying healthy.
Thank you so much. And then what sort of things can result from older adults not getting quality sleep?
So this can be, like I kind of mentioned before, it can impact their daily lives and cause them even to be less healthy. Like the video said we showed at the beginning, it can cause them to be more prone to falling or any other physical injury. So it places them at higher risk for developing other mental disorders as well.
Thank you so much. Now we have a final question. What can medication and treatments can we use for sleep disorders, and how can they affect our sleep?
Well, again, like we talked about earlier, there are medications that can benefit sleep, such as like melatonin or other things that will help you relax, help the body get into the right sleep cycles. And there are medications for other things like pain, high cholesterol, things that will affect your sleep directly and prevent sleep. So you've just got to balance other medications that the elderly especially might be taking for other conditions with medications that they need to be able to help them maintain sleep, which is obviously going to be best combined with good sleep habits and maintaining a good sleep cycle.
And we have a couple of questions for the audience, and as you can see, we have the answers put up here. And so if you want to take a look at this and you feel like your answers were similar with these, then we thank you for everything. Thank you for attending today's lecture and seminar. We hope that you're able to learn something. We hope that you can apply some of the things you've learned today in your daily lives. And once again, thank you for coming.